Grameen Ayurvedic Medical College, Terdal, Karnataka, Department of Rachana Sharir presents Anatomy of Stomach. Myself, Dr. Srikanth Vislavath, Assistant Professor, Department of Rachana Sharir. In this video, I am going to explain the anatomy of the stomach. It is also called gaster in Greek language and venter in Latin language. The stomach is the widest and most distensible part of the alimentary canal present between the esophagus and duodenum. The main functions of the stomach are it forms a reservoir of food and it mixes the food with the gastric secretions to form a semi-solid substance called chyme. The stomach controls the rate of delivery of chyme into small intestine to allow proper digestion and absorption in the small intestine. The hydrochloric acid secreted by the gastric glands in the stomach destroys the bacteria present in the food and drinks. Castell's intrinsic factor present in the gastric juice helps in the absorption of the vitamin B12 in the small intestine. These are the major functions of the stomach. Location of the stomach. The stomach is situated in the upper left part of the abdomen, occupying left hypochondric, umbilical and epigastric regions. It extends obliquely from the left hypochondric region into the epigastric region. Most of the stomach lies under cover of the left costal margins and lower ribs. Shape of the stomach. The stomach is mostly J-shaped. Its long axis passes downwards, forwards and to the right and finally backward and slightly upwards. It tapers from the fundus on the left of the median plane to the narrow pylorus slightly to the right of the median plane. Both the shape and positions of the stomach are changed according to the build of an individual. It is high and transverse shape in short obese persons and low elongated in tall weak persons. Measurements of the stomach. Length is 10 inches or 25 centimeters. The capacity of the stomach is variable as the stomach is highly distensible. At birth, the capacity is only 30 ml. At puberty, the capacity of the stomach is 1000 ml. In adult, the capacity of the stomach is 1500 to 2000 ml. External features of the stomach. The stomach presents following external features. Two ends, these are cardiac and pyloric ends, two curvatures, greater and lesser, two surfaces, anterior or antero-superior and posterior or posterior-inferior surfaces. Ends of the stomach. Cardiac end, also called as upper end. It joins the lower end of the esophagus and presents an orifice called cardiac orifice. The cardiac orifice is located at the junction between the lower end of the esophagus and stomach. It marks the level at which the curvature begins. The cardiac orifice does not have any anatomical sphincter, but it is guarded by the physiological sphincter. Surface marking of the cardiac orifice. Cardiac orifice situated to the left of the median plane, behind the left 7th costal cartilage, 2.5 cm from its junction with the sternum at the level of lower border of 11th thoracic vertebra. Next is pyloric end, or also called as lower end. The pyloric end joins the proximal end of the duodenum and presents an orifice called pyloric orifice. The pyloric orifice lies at the junction between the pyloric end of the stomach and first part of the duodenum. It has an anatomical pyloric sphincter formed by the thickening of the circular coat of muscle assisted by the deep set of longitudinal fibers of the stomach. The pyloric orifice can be marked on the surface of the body. It is about 1.5 cm to the right of median plane at the lower border of first lumbar vertebra, where the transpyloric plane passing. The stomach is relatively fixed at cardiac end and pyloric ends, but mobile in between these ends. The next feature is curvatures. The stomach presents two curvatures. One is lesser curvature and greater curvatures. Lesser curvature. It is concave and forms the shorter right border of the stomach. The most dependent part of this curvature is angular notch or incisura angularis. It indicates the junction of the body and pyloric parts. The lesser curvature provides attachment to the lesser omentum. Next is greater curvature. It is convex and forms the longer left border of the stomach. At its upper end, this curvature presents a cardiac notch which separates it from the left aspect of the esophagus. The greater curvature provides attachment to the greater omentum, gastrosplenic and gastrophrenic ligaments. Surfaces of the stomach. Antero-superior surface. It faces forward and upwards. Next is posterior-inferior surface. It faces backwards and downwards. Parts of the stomach. The stomach has four parts. Cardiac part, or also called as cardia. Fundus. Third one body. Fourth one is pyloric part. Cardiac part. It is the part present around the cardiac orifice. Next is fundus. The fundus is the upper dome-shaped part of the stomach, situated above the horizontal plane, drawn at the level of the cardiac notch. Superiorly, the fundus usually reaches the level of the left fifth intercostal space, just below the nipple. The cardiac notch lies between the fundus and the esophagus. The fundus is generally distended with gas or air, which is clearly seen as a radiolucent shadow under the left dome of the diaphragm in a skiagram. Next is body. The body of the stomach is the major part of the stomach between the fundus and the pyloric antrum. It can be distended enormously along the greater curvature. The last part of the stomach is pyloric part. The pyloric part is a funnel-shaped outflow region of the stomach. A line drawn downward and to the left from an angular notch to the greater curvature separate it from the body. The pyloric part is divided into three subparts: pyloric antrum, pyloric canal and pylorus. First is pyloric antrum. It is the proximal wide part which is separated from the pyloric canal by an inconstant sulcus called sulcus intermedius present on the greater curvature. It is about 3 inches or 7.5 cm long and leads into the pyloric canal. Next subpart is pyloric canal. It is a distal narrow and tubular part measuring 1 inch or 2.5 cm in length. It lies on the head and neck of parts of the pancreas. The last subpart of the pyloric part is the pylorus. It is the distalmost and sphincteric region of the pyloric canal. The circular muscles of the stomach are markedly thickened in this region and controls the discharge of the stomach content through the pyloric orifice into the duodenum. The position of the pyloric orifice is indicated on the surface by a circular sulcus. This is a pyloric constriction produced by the underlying pyloric sphincter of or pylorus and by the pre-pyloric vein of Mayo on the anterior surface of the pylorus. This indicates the position of the pyloric orifice on the surface. Thank you for watching. Kindly subscribe Grameen Ayurvedic Medical College Terdal YouTube channel.